and Finance will come to order. This morning, we will hear from Department of Health, Hawaii Health Systems Corporation. After that, we will be hearing from Department of Human Services. This afternoon, we had planned the testimony from Department of Education. That briefing has been postponed. We understand that Department of Education will receive further guidance from Department of Board of Education at next week's hearing. So in order to have a more productive hearing and to get full information from the Department of Education, Department of Education's hearing has been postponed and it will be rescheduled after we find a convenient date and time in working with the department. So with that, I will turn it over to you, Dr. Rosen.
Thank you, Chair Luke, and good morning. And good morning to the members of the committee and to the public who may be watching. For those of you who do not know me, I am Dr. Linda Rosen. I am the Chief Executive Officer of the Hawaii Health Systems Corporation. And we're privileged to be here this morning to present to the committee our budget request for the coming biennium. Joining me today, I have the Regional Chief Executive Officers. HHSE is organized into 5 regions and would like to introduce them. And I will start with Mr. Dan Brinkman, who is the Regional CEO of the East Hawaii region. Later in the presentation, I will show a slide that shows all the facilities in these regions, but we're now introducing our leaders. So Mr. Brinkman.
Aloha, Chair Luke and the committee. I'm Dan Brinkman, the Regional CEO for East Hawaii region, as Dr. Rosen mentioned. I have with me our Chief Financial Officer, Joni Walchin, and is privileged to be here to give testimony and answer any questions you might have related to our region's finances.
Okay, thank you, Dan. I believe I'm just going to call the other regions because I'm not sure I can scroll through the participants quickly, but for West Hawaii, our regional CEO is Mr. James Lee. I don't know if Jim's on. Jim, are you on? Possibly on the phone? I think he may be unable to join us. Then I would like to also introduce Mr. Lance Segawa. He is the regional CEO of our Kauai region. I'm not sure he was able to join. And then our Oahu region, I believe Derek Yoshi is in the waiting room and he Derek, are you there?
Good morning, Chair Luke and committee. My name is Derek Akiyoshi with the Oahu region. With me this morning is our Chief Financial Officer, Mike Hamamoto, and our Chief Administrative Officer, Sean Sanada.
Who's 6 feet apart, sorry.
Yeah, sorry, they're off camera. Thank you.
And then I believe Chair, you requested that I also introduce the CEO of our affiliate, Kahuku Hospital. And I'm not sure, I'm going to turn off.
Mr. McPhee, you're muted.
Thank you, and I apologize for that delay. Thank you for giving us a chance to discuss our finances up here, but I'm up at Kahuku Hospital up on the North Shore. So thank you very much.
Okay, thank you, Alan. Chair Luke, I am actually not sure who may be representing Maui Health Systems this morning.
Yes, Dr. Rosen, my apologies. Maui Health is not in the Zoom room yet. So what we will do is take HHSD and then we'll recess and then take Maui Health separately.
Okay, thank you very much, Chair. Once again, we will be presenting, hopefully you have our complete budget testimony, which we previously submitted, which has more detail. We did receive instructions for these briefings, so I'm going to follow that format and start with our mission and vision. I believe we have some, just 3 slides, but if you're unable to show them, I can, of course, recite the mission and vision. So HHSC, looks like it's coming up. Here we go. Okay. Ed, I don't know if you can go to full screen on the second slide yet, but I'll just wait a minute. There we go. Thank you. So here you see our mission is HHSC will provide accessible, high quality, cost-effective services which address the healthcare needs of Hawaii's unique island communities. Our vision is to be recognized as a progressive model for an accessible, integrated, patient-centered, and fiscally responsible healthcare system focused on assuring high quality care to improve the health of our communities. And just on the next slide, you'll see the actual facilities that are operated by the regional executives that I've just introduced. And I'll let you read them for yourself. But you'll note that we are predominantly on the neighbor islands. We are often in rural communities. And on the island of Hawaii, our hospitals represent 5 of the 6 facilities on the island. So we are the predominant provider of hospital services, including long-term care services on the island of Hawaii. And our 2 Kauai region hospitals provide long-term care services. We provide the only psychiatric services on both the island of Hawaii and the island of Kauai. So those are just very brief, some of the responsibilities that our facilities and services that they provide to the community. In your instructions, you asked us to discuss how the budget request that we have contributes to accomplishing our strategic goals, and particularly what measures we use to measure our success. So I just wanted to briefly state that in, of course, the healthcare delivery system, there are a lot of industry measures that all hospitals look at, which have to do with accounts receivable, our ability to expeditiously and completely collect revenue from the services that we provide, our management of our contracts, our accounts payable, and we have many other metrics that are standard for industry that we follow. In addition, in terms of the quality and safety of our services, you know, healthcare is a very highly regulated industry. The Joint Commission, CMS, et cetera, they do surveys. It's very, there's a lot of external scrutiny that we undergo. And I think that is a measure that can be looked at. And in terms of how we have done in these measures, I'll just briefly say that, for instance, that how hard we've worked at our revenue collection in order to minimize our request for a general fund subsidy. In fiscal year 20, we were able to increase our revenues by 2.7%, even though, as you can imagine, in the second half of the year, we had a big decrease in admissions. We had a 7.5% decrease in admissions, but we still were able to modestly increase revenue. Other measures that you might imagine with the pandemic have given us many, many challenges and has also reduced our other lines of business, which has caused an impact on our revenue. And you'll see that in a moment when I show you how we built our budget request. Of course, another measure of what we are doing in and for the community, and this is a few days old, but we had administered 30,530 COVID-19 tests and over 3,000 vaccines. And we are going to be, of course, continuing to be a major players in the vaccination of our communities so that we can come to the point where our society can be protected from circulation of the virus. So on the next thing that was requested was a comment on federal funds and loss of federal funds. For HHSC, of course, we do receive a lot of federal funds, but it is in the form of a payment for our services from Medicare and, of course, tangentially from Medicaid through the federal match. Otherwise, we don't normally get much federal funding. Now, this was, of course, an exception this year, and where we had federal funds related to the pandemic. And I'm proud to say that we worked very hard to maximize those funds. We received the past year 45 million, these are approximate numbers, in provider relief funds, 20 million in paycheck protection program funds, and 14.4 million in the Medicare advance payment program. Well, the next slide is a summary of our budget request and how it was built. And I think it's fair to say it is a large request, but I want to point out that what you see for our base, the 105 million at the top there in pink, has been our base for a number of years. And what has occurred, understandably, is that the legislature has taken a look at our need year by year, funded us 1 year at a time, and has marked that funding as non-recurring. So when we come back in, we have to ask for what we got last year plus what new we may need. And I just want to point out that in fiscal year 21, we received a total of 127,300,000, but that's not reflected in our base. And then as you see how our request is built, it is built primarily for collective bargaining increases that have occurred for which we were not funded. Some of you may not know that HHSC, unlike the executive branch departments, is not automatically funded for collective bargaining raises with general funds when they occur. We are generally marked as special funds, so we cover the raises as best we can, and then we come back to the legislature and ask for assistance. Similarly, and we have no control over those collective bargaining agreements. We have one vote out of 6. The inflation is pretty straightforward. The net income generating initiatives, we have some, so that's good. We're counting those. We are also having a savings in the fringe rate. The increases that have occurred in prior years have been a big part of our budget request, but we did get some relief this year with an actual decrease in the fringe benefit rate, which you see there as positive. One of the big factors is the 6,810, which are also having a savings in the fringe rate. The increases that we've I don't know where the echo's coming from. Sorry, I'll pause. So what I was going to describe is the lost revenue from COVID-19. Of course, people may think that the hospitals are at high business because of the pandemic, but there is another effect of the pandemic, which has been a reduction in some of the activities that normally generate revenue, particularly elective surgeries and emergency department visits. Now, the federal funds that I described a moment ago have provided the relief that we needed for that loss of revenue in the current year. But we don't know if any of those programs will be available. We hope so with the new administration, but we do not know what we can. We have already learned that some new programs have tighter, for instance, the Paycheck Protection Program has tighter requirements that may limit us. And also it's possible that if we all pull together and we get everyone vaccinated, that the lost revenue may not be what we predicted, which was the 10% loss. But those are the elements that built our request that you see before you. And in addition, you see that there is a additional request that is related to potential development of an adolescent behavioral health unit on Hawaii. But the rest of basically our request is not for any new services or programs, but to be able to maintain the critical services that we currently provide to the community, and that we are always prepared to serve the community with a very high quality standard of safety in all of the regions that we operate. So I believe that according to the instructions, these were the elements that you wanted us to cover, and I don't want to take too much of the committee's time. So I'll pause there in case there are any questions. Thank you, Chair.
Thank you. Mr. Chu, can you take that off? Yeah, thank you. Dr. Rosen, West Hawaii region has just joined. Would you like to introduce them?
My apologies. This is Jim Lee, CEO of West Hawaii region. Frankly, I was having lots of technical difficulties. Again, my apologies. Thank you.
No problem. Welcome to the meeting. So that concludes Dr. Rosen's presentation. Any questions from any of the members? No questions. Representative Wildberger.
Thank you, Chair. I'm interested in the Ohana zones on Maui. I'm wondering about an update on what's happening with the project there, please.
I'm sorry, Representative. I'm not familiar. We do not operate any facilities on Maui anymore. That is all Maui Health System. So I really don't have much information regarding Maui. Sorry.
Representative Wildberger, I think that question can be given to DHS when we hear from DHS.
Oh, sorry. I thought that was all we were going to get from this group. I'll ask again later. Thanks.
Okay, thank you. Representative Martin.
Hi, good morning. I have some questions about Leahi Hospital. Is that something that you are managing?
Yes, the Oahu region, Leahi Hospital is part of the Oahu region, and our regional CEO is here with us today, and I think he would be the best one to answer your questions, and I'll take over to him. Thank you.
Yeah, so I used to be housed at Leahi working at Jabson, and so I'm aware of all the lab, clinic, and office space that we used to use there before switching to Kaka'ako. And I was wondering how that space has been redeployed, or if it's just vacant. It's such a valuable piece of real estate, so I just wonder how it is being used.
Thank you for the question. One of the things that we're working on is with Kapiolani Community College. So they're occupying some of the lab spaces and performing some of their learning in those labs. Some of the other spaces are in relative disrepair. So what we're trying to do with our CIP projects, amongst other things, is to at least bring the spaces into usable conditions. So that's part of our plans for the future. I do understand that we want to make best use of the resources that are available to us. So we're constantly working on that.
Thank you. As just so the vision is to use it for teaching, or what types are you thinking about expanding your care services there?
So we both we want to use it for both teaching and possibly sources of revenues related to either health or education purposes. Thank you.
Mr. Sagawa of Hawaii region has also joined. Mr. Sagawa, would you like to introduce yourself? Turn on your camera and introduce yourself to the committee and the public. Mr. Sagawa, your audio is not working. We can't hear you. It could be because you're, you need to say that you're using computer audio.
Is that better?
Yes, better, thank you.
So again, I'm Lance Segala, the Kauai Region CEO. Nice to be here.
Thank you and welcome. Any other questions, members? If not, thank you very much, Dr. Rosen, and we will have HHSC exit, and Mr. Rhombus is already in the Zoom hearing, so just give us a few seconds to allow HHSC to exit, and then we can pick it up. Any other questions, members?
A significant, devastating financial impact on the health system. Much like HHSC just said, our revenues are down, no elective surgery. We're seeing no very small amount of emergency room visits for much of the year due to lack of visitors, but also our residents not using the facilities during the height of the pandemic. So the financial impact has been significant with revenues down and our costs up. This is not the time to be reducing staff. We've had now 3 surges throughout Hawaii, and the costs are up and the revenues are down. We appreciate whatever assistance the legislature can provide. This is a year where we need it more than ever before. Our commitment has always been to reduce our subsidy requests year after year. This is the first time that we're asking for the same amount as we had last year because of the significant impact of the pandemic on our community and our hospital. We stand by our testimony, and I'm happy to answer any questions you may have.
Thank you very much, Mr. Rhombus. Any questions, members? Representative Wildberger.
Good morning. Thank you, Mr. Rhombus. Appreciate you joining us today, and wanted to thank Maui Health Systems for their vaccine ramping up program. We're getting it out, and everybody's really anxious, especially our frontline workers who are, faced with our increased tourism groups. So thank you for that. I wanted to ask about what kind of commitment Kaiser is prepared to make to Maui Health Systems budgetarily in the event that the legislature doesn't find funding for Maui Health Systems this year.
Well, I have not asked Kaiser for that specific answer. Kaiser's a partner. We're affiliated with Kaiser. According to the documents on the transition, we stand on our own to be self-sufficient within the timetable of the subsidy. So we have been focusing on doing whatever we can, independent of Kaiser, to be financially strong and self-sufficient. Depending on what we get from the legislature, we will discuss that with Kaiser, but I have not had that discussion with them. Thank you, though. And by the way, the vaccination program to me is the key. It's a light at the end of the tunnel. And we're going to do everything we can to expand it with additional sites on Maui as soon as more vaccine is available.
Fantastic. If I can be of any assistance in helping any South Maui vaccine events, I'm happy to help facilitate.
That's our next location we're looking at. Absolutely.
Great. So I'd love a follow-up. I'd love to know what Kaiser's commitment will be if we're unable to provide funding to Maui Health Systems. Will Maui see a reduction in services, or will Kaiser, as a partner in Maui Health Systems, make a financial commitment to maintain services that would otherwise possibly be lost if bridge funding wasn't able to be provided?
I will follow up for you on that answer.
Okay, thanks a lot. I appreciate your time.
Absolutely.
Thank you. Any other questions? Representative Sayama.
Thank you, Chair. Mr. Rembis, in the letter that was sent earlier, in the final paragraph, MHS emphasized that they needed about 19 million to 16 million for the bare minimum of the operations there. I was wondering, between 16 and 19, there's obviously a 3 million gap there. I was wondering what that 3 million would be.
I believe our request was for 19 million for this fiscal year and 16 million for our next fiscal year.
Thank you for clarifying. I have one additional question. In one of the items that you listed that you need additional purchases for, you listed ventilators. I was wondering, does MHS have a sufficient amount of ventilators currently?
We do now. We have purchased additional ventilators throughout the year, and I believe we have adequate supply to deal with any potential surge.
Okay, thank you. No further questions.
Thank you, Representative Kobayashi, followed by Representative Wildberger.
Good morning. You said that revenues are down. Could you give us an idea of how much? And what is the expected revenue loss for this coming year?
Well, I don't have those numbers off the top of my head. I can tell you we're just closing unfortunately, our fiscal year is a calendar year, and our calendar year, which we are closing now, shows a loss close to $10 million. That's with CARE Act funding. That's with the state subsidy. So it is, we're having difficulty even with the assistance that we've been able to generously accept. But I can give you those numbers.
So that is a $10 million revenue loss after federal stimulus subsidy.
A net loss after all subsidies.
Thank you.
Thank you, Representative Wildberger.
Thanks, Chair. I've got a couple calls from Kupuna or people helping Kupuna who don't have computers. Do you all have a telephone manner of taking reservations for vaccine at the hospital by any chance?
Well, we need everybody actually enrolled in the computer, but we have people now that will help people enroll. We have a couple computers here. What we're trying to do right now is work with a couple of not-for-profit agencies. MEO just reached out to us yesterday and get some of the people in the community to help Kupuna register on the VAM system. So when they show up, they're already registered. So we are working with new partners. We have a couple stations here and we're not turning anyone away. Yesterday, some people had to wait a little bit because we wanted to register them into the VAM system. We need more here and we need people in the community. If we can get members of the community to help Kupuna, and I'm going to reach out to the Nisei organization, all the organizations, help their members get online. It's a very simple registration process, but if you don't have a computer or you're not used to using a computer, even a simple process is difficult. So we're gearing up very quickly, working with the community. It's a real need. You hit it right on the head, and we're going to have to help them more and more.
Okay, so I know you don't want me to tell people to just go down to the hospital to register.
No.
Is it Still okay to tell them now to go to MEO, or should we wait for more information from you once your partners are set up?
They just reached out to us yesterday. Probably by next week, they'll have something in place and some others. I will send up a legislative update to all the Maui legislators, as I've been doing, one day next week, as soon as those partnerships are firm.
Thank you.
But
Very
we
much appreciate your communication.
don't ask people to come, but if they come and they're not signed up, we're not going to turn them away.
Fair. Okay. I really appreciate the updates that you've been sending us, and we'll stand by for a solution to computer literate challenges. Thanks.
You're welcome.
Thank you. Any other questions? If not, thank you very much, Mr. Rhombus, and the work that you folks have done. And so what we will do is we'll take a short recess and allow Maui Health to exit this hearing and allow for our Department of Human Services to exit.
Thank you very much.
Thank
Stay
you.
safe. Bye-bye.
Finance, sorry, Director, let me do an intro. Thank you. Committee on Finance will reconvene for our continuation of informational briefing from the various departments to brief us on the executive budget. This morning we have Department of Human Services. Welcome, Director Betts, and I will turn it over to you to make the presentation.
Thank you very much, Chair. Good morning, Chair Luke, Vice Chair Cullen, and members of the committee. Kathy Betts, Director, Department of Human Services. Happy New Year, and thank you for the opportunity today to present on DHS FY 21 to 23 biennium highlights. I believe that Malia Tomdinick and Mark Choi in my office will be sharing the PowerPoint on our end. So I'll wait for those slides to start, and then I can go into a brief introduction. I'm going to go over just a real brief overview of the department and then turn it over to Hakeem Wansafif with Hawaii Public Housing Authority to go over his slides, and then I'll jump back into DHS HMS IDs. Alrighty, next slide, please. So this is our DHS leadership team who are present on the call with us today. We have our division administrators, attached agencies, and attached commissions present today. Next slide, please. I'd like to start by going over some of the department's basic foundational values and tenets, which guide the work that we do, as well as the budget that we created that we'll be presenting today. And then we can go into HMS program IDs for more specific information on budget items and legislative proposals connected to the budget. We have a constitutional obligation to provide services to persons in our state, found in Article 9, Section 3, and we hold that obligation very dear. Next slide, please. We're also guided by the Aloha Spirit and aspire to treat each individual with dignity and respect. Next slide, please. In session 2019, we were able to enshrine our multi-generational approach to reducing intergenerational poverty in state statute. That was Act 82. We recognize that silos within our departments cannot serve the whole family. Families are not siloed and have multiple needs in order to be self-sufficient and healthy. Next slide, please. All right, now I'm going to go ahead and turn it over to Hawaii Public Housing Authority Director to briefly present his budget requests before going through the rest of our HMS IDs.
Aloha, Chair, Vice Chair, members of the Housing Committee. Happy New Year. Wishing you all a safe, healthy, and a successful 2021. My name is Hakeem Wansafif. I'm the Executive Director for the Housing Authority, the Hawaii Public Housing Authority, and I do thank you for this opportunity to provide comments regarding budget programs, HMS 220, 222, and 229. I know you have our testimony, so I'll keep this very brief and just a quick summary. Next slide, please. The HPHA is a full service agency and is attached to DHS for administrative purposes only. And it's one of the largest public housing authorities in the nation and one of only 3 statewide agencies. Out of the 300 plus full-time public servant positions, only 1 is a funded, general funded position. And we are governed by a board of directors that set the policies for HPHA, and we as management, we execute those policies consistent and as mandated by HUD through an annual contribution contract that we have with them. The major programs that the administrative offices support are the property management and maintenance branch, the Section 8 subsidy program branch, and the construction branch, as well as other offices. Next slide, please. Out of $125 million or so that we get for program funding, 95% of it comes to the HPHA from federal funding for our public housing, for Section 8, and for a project-based contract administration. It's a program that has, in all, we serve over 35,000 of the most vulnerable population in our state with safe, decent, and sanitary housing. Next slide, please. The federal low-income public housing units, we have 5,406 units, and the state units are 864, totaling 6270. For the housing choice voucher, also known as Section 8, we have a budget authority voucher for 3,850 vouchers. And for the PBCA, that's the project-based contract administration, that's 3,000 units. Next, please. Next slide. In addition to our regular funding, we received CARE Act funding directly through HUD, $4.1 million for the public housing component, and a little over $2.5 million for the Section 8 program. And our funding must be used by the end of this year, 2021. And although this year was for everyone filled with unexpected challenges, it was also an opportunity for our public servants. They've been very creative at resolve and collaboration, from providing all the necessary PPEs to our staff to continue showing up every day to assist the most vulnerable, let it be fix a unit or fix an issue that's there or providing vouchers. To distributing tens of thousands of staff-made and reusable cloth masks to our tenants, distributing cleaning supplies and hand sanitizers to families that tested positive, and implementing Hawai'i administrative emergency rules to protect the public and our housing communities. We coordinated with Department of Health nurses and National Guard to conduct outreach, COVID-19 outreach, as well as coordinated the surge testing, as well as many other initiatives. We also partnered with the University of Hawaii and created a new COVID website just so we can keep our tenants and community informed. We named it hphaishereforyou.org. And outside our housing, we also helped Haima to avoid lapsing some FEMA funding by administering the Aloha Cares Act emergency feeding for the 65-year or older or the disabled, resulted in approximately 500,000 meals that we served. All of these efforts resulted in serving over 1,000 families, serving them safely and moving them into safe, decent, and sanitary housing. Next, please. In front of you for our legislative ask, HMS 220, $10 million CIP lump appropriation, you'll find in page 72. This is to continue our mandate under a contract with HUD to make sure that our projects are safe, decent, and sanitary, and to also fix any units that may become available. This is specifically important because our funding comes based on vouchers that are leased and based on public housing units that are occupied. If it's not occupied, we do not get funding for it. The second that you have in front of you on page 73, HMS 222, that's increase in the federal fund ceiling. The requested ceiling increase is needed due to the anticipated grant award being more than the appropriation. Just FYI, this increase was approved by Governor Ige on September 3rd, 2020. The third item that you have for HMS 222 on page 74, it's 7 N-funded positions. This is needed because we increased our capacity, we increased our the families that we are serving due to $2 million that HPHA received, and we're requesting 5 N-funded positions, for federally funded position for this Section 8 program. Next slide, please. 2 more, please. It's HMS 222. This is on page 74, and that's for the rent supplement program. I know you're very familiar with it. This is 100% state funded, and this is so we can keep those who we are serving, we can keep them served. So we're asking for the $500,000. And for HMS 229 that you'll find in page 170, that's the state CIP funding. The funding to support the staff and the HPHA's construction branch to administer CIP fund to ensure timely and accurate encumbrance and obligations statewide. You have that in the slide. Next slide, please. The biggest ask is the $40 million for the school street elderly housing. This is for 100% affordable for life, 250 units at our elderly, at School Street location. We thank you for the appropriation that you gave us last year that allowed us to move forward expeditiously. The City Council approved the 201H application in November of last year, providing us approximately $9.9 million in fees and other exemptions from statutes and ordinances and chapters. The condition of the requirement that the construction starts within 24 months. Based on our latest schedule from the developer, we anticipate shoveling the ground the end of this year, and they are on target to submit an application, tax credit application to HHFDC by the deadline that they have of February 17th of this year. This is expected to generate at least 250 jobs with a labor value estimated at around $45 million. And I believe this is our last slide for the HPHA. I do thank you for your time. Much appreciated.
Thank you, Hakeem.
Thank you.
So I'm just going to go over an overview of the department. You can see this is our org chart. We have 4 divisions, 6 staff offices, 2 attached agencies, 2 attached commissions, as well as the Governor's Coordinator on Homelessness. The department's multiple programs are very complex, including multiple federal oversight agencies, federal regulations, which mandate a certain amount of state match or a fund match. We have federally block grant funded programs, which require a state maintenance of effort in order to draw down and utilize the federal funds. We also have multiple split funded positions, which if A funds are no longer available, the N funds cannot be utilized. Lack of compliance with the state maintenance of effort places us at a higher risk of federal audit, sanctions, and potential corrective action or litigation. So in order to examine any A fund reductions in our budget, we need to be mindful of those variables. So you can see our 4 divisions, the services that we've really aggressively kept up in meeting the demand during this pandemic. I'd like to give you a brief overview of how we developed our biennium budget and how we propose to keep the state safety net intact for our most vulnerable residents and families through the biennium, and most importantly, through this public health crisis, which has highlighted so many detrimental economic, health, and safety impacts on our island families. Over the last year, as I mentioned, DHS has taken aggressive actions to protect the health and safety of the individuals and families we serve. We work to ensure all essential services, as you see on this slide, would continue to be provided, albeit in a modified manner. We applied for all federal waivers to ensure flexibility in service provision and the ability to serve as many residents as possible. To meet our strategic goals, the department used 4 broad considerations in prioritizing budget requests. Number 1 is preservation and improvements to the safety net, which serves our most vulnerable residents. Number 2 is enhancing supportive services, including investment in our workforce. Number 3 is transforming government through continued modernization of IT systems, which are tied to a program redesign, program development, and human resources. And I think the largest one is number 4, leveraging federal funding. This is absolutely crucial during a time where general funds are limited. Our budget strategy also included our mission, vision, and our strategic objectives, which are aligned with our values. Improve the self-sufficiency and well-being of Hawaii's residents and families, improve service integration and delivery for sustainable outcomes, and improving staff health and development, recognizing the stress and the strain of the relentless pace with which they've worked over the last year. So we started, in terms of budget strategy, we started with Act 9, Session Laws of 2020 as a starting point. As you recall, Act 9 reduced general funds that make up the state match for 319 positions with A fund salary totals of a little over $9 million. The salary reductions included 101 filled positions, of which 37 are within the Social Services Division, which oversees child welfare services and adult protective services. As a strategy to meet the general fund reductions and to meet the additional budget reductions of the potential 10%, we looked to programs where we could replace general fund expenditures with federal funds or special funds, and examined what our programs could tolerate without causing harm to the residents we serve. This required thoughtful and careful consideration of the various block grants, federal funds, and funding mechanisms. We used trade-offs and transfers of funds from other expenses to fund positions where Act 9 had deleted general funds, and our budget reflects those trade-offs. So here is our DHS budget highlights. We are requesting to restore position funding using trade-offs and use of operating expenses. We're requesting to maintain the DHS special and revolving funds, which help support us to do the work that we've been doing. We're requesting to maintain the position count of defunded positions. And we're planning to retain workforce for crucial responsibilities positions subject to the hiring freeze. So we've identified employees that if potential furloughs do come down the pike, we would request to be exempt. Those are 100% non-general funded positions, positions that work in a facility or environment that operate 24/7, and other split funded positions. We've also submitted 46 B2 requests to fill. Those are for the really critical vacant positions that have no warm body in them, and we desperately need them in order to sustain the pace with which we work. Next slide, please. So these are really truly temporary stopgap measures. These are not meant to be sustainable budgetary items, but sorry, I heard somebody speak. So we're requesting to restore position funding using trade-offs and operating expenses. We remain keenly cognizant that using operating expenses for positions may mean less funds for services. So it's a very delicate balancing act that we're trying to undertake. As I mentioned, special and revolving funds help support our service delivery. And so we're requesting to maintain those. We are requesting to use sustainability funds through MedQuest to support our HMS 904 administrative positions. Maintaining the position count of defunded positions. We also have emergency appropriation requests for general assistance program and Medicaid. And we have 6 administration bills tied to the budget. Next slide, please. So this is just a preview of the Consolidated Appropriations Act of 2021, which passed at the end of December. You can see that we do anticipate future federal funding that will assist us in continuing the service delivery. Knowing that eliminating our positions that are currently defunded will not help the general fund, we're hoping to retain those positions, given that the fact that more federal money is coming down the pike and we are able to support additional positions in the future, hopefully. You know, in 2009, I was representing the department when many RIFs and position cuts took place. It took over a decade for certain divisions to really restore the position count and their ability to sustain the workforce. So I do know keenly that it's important to retain those positions just because it takes so long to restore them. Next slide, please. So these are the restoration of salaries for defunded critical staff. As I mentioned, they were defunded through Act 9 of Session Laws, Hawai'i 2020. This impacted 319 positions because federal funds cannot be used to fund split funded positions without the general fund match. So we're looking to restore the salaries for 238 critical defunded positions. As I mentioned, we were unable to provide trade-off funds for the balance of 80 positions, but we are requesting to retain the position count. Next slide, please. So these are the administrative legislative proposals. As noted, 6 of the bills are tied to the budget. For subject matter bills, I'm going to allow our division administrators to go over their legislative proposals in a little bit more depth. Next slide, please. And this is just an overview of our special and revolving funds. Hospital sustainability, nursing facility sustainability, our interim assistance reimbursement special fund, which is connected to our general assistance population, our spouse and child abuse special fund, which helps child welfare to do critical intervention and prevention work with families, We're hoping also to be able to increase the ceiling on that fund in order to allow us to implement the Family First Prevention Services Act, which was submitted to Administration for Children and Families in earlier December. Also the Randa Shepherd Revolving Fund, which helps support our blind vendors through health insurance. Next slide, please. So this is for HMS 904 specifically. We're requesting to restore salaries of 22 defunded positions from Act 9 using sustainability program and nursing sustainability program funds. So we would be changing the method of financing in order to support HMS 904, which is our administration. Some of those positions are in ACRA, which is Audit, Quality Control, and Research. They create internal audits to ensure our payments comply with federal regulations. We also have a language access position, which is required by federal regulations. It's the only one position for the entire department to ensure LEP residents can have equal access to our benefits and services. So this is a crucial position. Next slide, please. All right, I'm going to go ahead and turn it over to Dr. Moore Peterson, unless there's any pending questions that need to be answered right now. Okay, thank you.
Aloha. Thank you for this opportunity to talk with you today about the MedQuest division and our budget and our programs. As many of you already know, the MedQuest division runs the Medicaid program for the state of Hawaii, and the Medicaid program provides essential critical health insurance coverage for the most vulnerable of our community. Next slide, please. I'm just leading off with our initial budget requests. As Director Betts noted, we are requesting the restoration of the salaries for defunded positions, or at a minimum to retain the FTEs for defunded positions. We're also looking to restore all or a portion of program reductions from our administrative budget. We had included a request for housekeeping to delete some unestablished temporary positions that actually had been established elsewhere in the department. We have included a shortfall request for our program area, in which we have been projecting $34.7 million a deficit for fiscal year 22 and $55 million in fiscal year 23. I will spend quite a bit of additional time talking about those projections because some changes have happened within the last 30 days that have dramatically impacted our budget in a good way. Finally, I'll spend some time going over the sustainability bills, the hospital nursing facility, and the proposal for a new Medicaid health insurance sustainability fee. All of those are desperately needed to help maintain our budget. Before I go into that, I'd like to spend a little bit of time talking about the impact of the pandemic and what MedQuest has done to respond to that. So one of the first things that happened is in mid-March, is we saw almost an immediate impact of an increase in applications to our program. Since mid-March of 2020, we've had a 30% increase in our applications during that time period. It varies by county, as you can see, but the greatest number on Oahu, but then proportionately, we've seen a higher proportion of applications coming in from Maui and Kauai. Next slide, please. That has translated into increase in our overall applications. At the end of December, the first part of January, it's 396,000, or almost 397,000. Our most recent numbers that we just received, it's about 398,000. We are expecting to be over 400,000, likely by the end of this month, by the end of January. That is, as I noted, about a 20% increase overall in our number of people that we're covering, which is we're nearing a third of the population now on being served by MedQuest. This increase is due for two different factors. One is the fact that we do have this increase in applications, but the other is that we have received enhanced federal match to help cover this increase in the population. In order to accept that enhanced federal match, we are required to not disenroll people who are on the being served by Medicaid, by the MedQuest program. So the combination of people not dropping off, as well as the increase in applications, has led to an increase in our population. Next slide. Thank you. Thank you. So the increase in enrollment, just like the increase in applications, does differ by county. So again, the greatest number is on Oahu, but proportionately, we've seen a higher proportion increase on both Maui and Kauai. Next slide, please. As I noted, we had a tremendous applications increase. One of the things I would like to really call attention to is that we have been able to keep up with that application increase and get people enrolled in a very timely and quick, efficient manner. The reason that we were able to do that is because of our online application system that we call Kolea. It's a system that we've invested in since 2013, made lots of improvements and changes over time. But because of that system, we were able to move very quickly from about a 60-40 online and phone application ratio to paper applications. We've been able to switch it now to 90-10. So about 90% of all of our applications now are coming in online using this Kolea system or via the phone. The other reason that we were able to successfully move and very quickly to be able to cover this tremendous influx of the number of people and the number of applications is that we very, very quickly helped our staff be able to telework. That required quite a bit of investment into laptops and changed phone systems and monitors, et cetera, and a lot of IT support in order to help us all telework. So that was also a tremendous investment and allowed us to keep up with the increase in the work. Nonetheless, the ongoing hiring freeze and the inability to hire some of these critical positions is beginning to have an impact on our ability to be able to maintain this. So some of the critical functions that we're starting to see beginning of breaking points here are the continued timely processing of applications, ensuring that our staff are able to continue to telework. And then there's been a tremendous increase in the amount of work that the pandemic has brought because of the application for waivers and for exercising emergency rules and changes in processes and new guidelines and changes in the delivery of the healthcare system itself and financing. And that is on top of the day-to-day Medicaid work that we have and that we've needed to continue. So that combination of things has really begun to, well, it has been very, very stressful, but it's begun to the longer the hiring freeze lasts, the more challenging it is to maintain these critical functions. Next slide, please. So I realize there's a lot of information packed onto this particular slide. I'm going to go through it step by step. This covers a summary of the MedQuest budget situation from the past, the last fiscal year, where we are currently, and then what we're projecting into the future, along with some a teaser for updated projections. So in the last fiscal year, as I mentioned, we received as part of the FCRA, which is the Family First Coronavirus Recovery Act, we received enhanced federal match. For state fiscal year 2020, we received an estimated additional $60 million for state fiscal year 2020. That allowed us to be able to take a reduction of $30 million, again, last session, along with an additional lapsing of $18.4 million from HMS 401. In other words, we had a general fund surplus in the last fiscal year. In the current fiscal year, we have continued to receive that enhanced federal match. It is tied to the extension of the public health emergency. We had, when we first began the budget process and up until last week, we were anticipating and had projected about a $45 million general fund surplus based on our appropriation. We had anticipated about $90 million for state fiscal year 2021, which is our current fiscal year, that was contributing to our ability to have this surplus. However, just last Friday, the public health emergency was extended, which means an extension of the enhancement of the federal match. Additionally, there have been some other policy changes that have led to some additional savings to our budget. For the next biennium, for fiscal years 22 and then 23, or 21, 22, 22 and 23, we have been projecting a pretty sizable budget deficit. In large part, that was because we have had this increase in the number of people that we're serving, and we are not projecting that the extension of the enhanced federal match will continue. So our projections have been about $35 million of a deficit for 21-22, and then $55 million, or close to $55 million deficit for the following year. We do have some updated projections that I will share with you in just a moment. One of the notable items that was in place as part of the Consolidated Appropriations Act is that it restored Medicaid for residents from the Compact of Free Association states. So we are also projecting some savings from that as well, of about between $18 to $20 million. That will have an impact on our projections. Next slide, please. So we included this as an example of what our original projections were, and then noting at the bottom that it does not include the restoration of Medicaid for COFA residents, nor does it include the extension of the enhanced federal match. And we've also updated our actuals because we know how important it is to keep everybody apprised of the changes to our budget, given the size of our budget. The other thing I just want to draw your attention to is that of how much leveraging we do of the federal funds. So currently we are anticipating, for example, in fiscal year 2022, with these original projections, it was about $34.7 million of shortfall that we were estimating, but that led to or leads to over 200 million of federal funds. So the total deficit then in our projected deficit in our budget is $250 million when you combine all the funds, both the federal funds and the general funds together. Next slide, please. I'm very pleased to note that our redoing our projections that include updating updating it based on the continuation of the enhanced match, the restoration of the Medicaid for the compact for the COFA residents, as well as updating our actuals. That combination of things has flipped our, not completely flipped, but has changed our projections in a positive way. So instead of about $45 million in quotes surplus, we're now anticipating about 95.7 million. This is all brand new information. We just completed these updated projections yesterday. So this is hot off the presses. And we will be working with Budget and Finance on revising the budget based on with the governor's office based on these updated projections. Our projected deficits for the next biennium have also changed. So instead of about 34.7 million or 35 million, it's now 12 million. And instead of, and I can't quite see it, instead of, I can't see the number, but I think it's for, instead of 55 million, it's about 34 million. Next slide. All right, I wanted to spend a little bit of time talking about some of the ways in which we are looking to address some of the deficits that we're projecting. Next slide, please. As many of you know, we have been operating a couple of sustainability programs for over 10 years now. One of them is or about 10 years now. One of them is the Nursing Facility Sustainability Program. Using this slide first as a demonstration of how it is that the sustainability funds operate. These are estimates as for fiscal year 2020, in other words, last fiscal year. So what happens is that a fee is assessed on the nursing facilities that goes into the sustainability fund. There is a state share of that we use, which is 12%. And then from that, once the 12% is taken, then the remaining 88% goes towards the nursing facilities share of the provider fee. We are able to leverage federal funds through the match, and then that gets built into the capitation rates for an increase in reimbursement to the nursing facilities. So so that the nursing facilities get a net benefit from the fee in which they're being assessed. Next slide, please. The Hospital Sustainability Fund has worked the same way with a lot more dollars. This year we are in conjunction and in collaboration with HAH, we are proposing to operate the program slightly differently. So it would flow the same way in that the hospitals would pay a fee, a provider fee. It would be collected instead of 12%, it would be, we're projecting 10%, and then 90% would flow to an increase for the hospitals for increased reimbursements, as well as $25 million that would go to the Medicaid program to help sustain the Medicaid program itself. It flows through the same way in that we get federal matching dollars from CMS. Those increases are built into the capitation rates that are paid to the managed care plans, who in turn pay the hospitals. The hospitals would maintain $125 million net benefit from this program, even with the increase of the $25 million to flow to the Medicaid program. Next slide, please. We are also proposing a new type of sustainability program, which would be on health insurers. This would help sustain, again, help sustain the Medicaid program. The flow of dollars would be very similar to how the nursing facilities and the hospitals would work, but instead of going to increase the particular providers' reimbursement rates, it would flow to the Medicaid program. We would leverage that to benefit MedQuest and to help address the deficits that we have projected. We, based on the structure of it, we are currently estimating about a net benefit of $15 million. We would structure the fee based on the health insurers, based on the number of members that they had, and then whether those members were Medicaid or were commercial and private. The bulk of the payments and the bulk of the fees would be charged on the Medicaid side, because that would allow us to leverage the federal Medicaid funds. And that's how we can leverage additional federal funds without disrupting the health insurance market in any major way. Next slide. And that's it for the MedQuest.
So good morning, Chair Luke. My name is Brian Donahoe, and good to see you again. It's been quite a long time, and good morning, committee members. I'll start off very quickly and just head right into the increase in numbers, unless you have any points you'd like to make with Judy Peterson Moore. Chair Luke?
No, go ahead, whatever you want, however you want to proceed.
Okay, thank you very much. Next slide, please. So this is an example of what we've seen in terms of the number of recipients in the SNAP program. And it's a pretty representative chart that shows what we've seen as far as increases in all of the BESD programs. And I'd just like to note, the numbers for SNAP are often coming right on the heels of those that drop off of the unemployment insurance rolls. And so as you see folks that have exhausted not only their pandemic UI, their base unemployment insurance plus extended benefits, usually it's about a 39-week cycle, then you start to see them drop off and then they become eligible when applying for the SNAP program. So an indicator for those of you who are not in the division or the department, as you see individuals falling off of UI roles, they become our clients at a significant loss in income, by the way, because our programs truly are poverty level and basic safety net supportive dollar amounts. Next slide, please. What we saw during the pandemic is an increase in applications that for many months was much higher, but over the course of the pandemic has been an increase of about 50%. In addition, our recipient increase was about 20%. Our baseline numbers previous or prior to the pandemic were about 150 to 155,000 individual recipients, and now we're seeing in excess of 180,000. So the increase has been steep. Our success in terms of keeping on top of the work has been based in a major way on our technology leverage and our work with Mark Choi and our OIT office. And I'll tell you right now, the PAIS, the Public Assistance Information System, we popped up an online application in about 3 weeks. And in that amount of time, from that point in time in June to current, we've taken right about 90,000 applications to the PAIS website. Prior to the PAIS website, half of our applicants met with the agency in the lobbies, and the other half met by filling out an application and either mailing it in or dropping it off at the processing centers across the state. In addition to the PAIS website web application, We also have moved our work across the entire state, so we're able to leverage capacity opportunity through all of the processing centers. And so some locations will have fewer local applications, but we can still keep them busy working on other processing centers work across the state. In addition, our approach to telephone support has been changed dramatically in that we have now are moving into a statewide telephone support so folks can call in and receive their information and or ask questions of the agency. In an effort to make sure that we were able to leverage capacity, also the teleworking approach for us has been absolute. And prior to the pandemic, we really had no telework, or we had just a few people based on an accommodation. And now we have in excess of about 60% of our regular staff who are eligibility workers determining eligibility for our cash and food programs. They're at home and we're rotating them in and out, so there's a degree of parity between all of our workers coming to work and not. And we've really had to increase our laptop, camera, and phone system upgrades in response to this. And I really do want to say it mirrors much of what Judy Moore-Peterson was talking about in terms of IT being part of the solution for us. We believe strongly that our business process is solid. We believe also that our ability to leverage our IT position has been critical. And right now I want to point out also the federal waivers that we've been able to enjoy as it relates to the elimination of an initial interview and also the suspense or extending the certification periods has allowed us the opportunity to use more of our staff on initial applications rather than the ongoing maintenance work. So please, next slide. As you can see from this chart, and I think that this chart is good in terms of showing the increases for the financial assistance programs. So TANF, for those who are not steeped in all of the acronyms, it's temporary assistance for needy families. And those would be families that qualify based on having minor children or dependent children, but also are citizens. TAONA is temporary assistance for other needy families, and that would be families that have, again, dependent children, but mixed citizenship within the household. AABD is assistance for the age blind and disabled if they're not eligible for the Social Security disability, and most of the time, again, these would be non-citizens. And GA is general assistance. And GA is a bridge program allowing those who do not have dependent children to receive a benefit while they're waiting for their disability determination. The increase in recipients has been significant, and it's noteworthy to show a 218% in the TAONA recipient category. But from a dollar point of view, the GA recipient increase of 29%, loosely 30%, is of significant dollar value to the agency and something that we also are asking for additional support for the biennium budget. Next slide, please. For those who are not as familiar also with the pandemic EDT, so we call it PEDT, those funds are used in support of the families and students that previously would have enjoyed free and reduced price lunch support through the Department of Education, and it is a SNAP funded program. And for the two rounds, both those families that are SNAP recipients and those that were not, you can see that the amount of dollars that we've been able to bring in has been about 61 million. I would like to note that this has come at a significant devotion of time from our agency, but also in partnership with the Department of Education. There are many states that were not able to leverage these funds, and we really took it upon ourselves to partner up closely with Department of Ed And the assistant administrator for BESD, Scott Nakasone, has worked tirelessly to try and make sure that this has been a successful program. So we're proud of it, and it's taking an additional and continued devotion of effort to make this happen. In terms of the SNAP emergency supplements shown in the table at the bottom, the emergency supplements are the additional amounts that are paid on top of a family's allotment. And if a family is not receiving the maximum amount within the SNAP category for that household size, they then are able to get an additional amount. It's not a huge amount, but it's something. For these families that are struggling, it is. So an individual that was not receiving the maximum amount, they could receive an additional $57 a month. I mean, that's the kind of money that we're talking about. But I will note, though, that if you look at it and you know that based on an earlier slide, we have about 180,000 recipients, and those that received the SNAP supplement are those that were not receiving the maximum. It shows 136,000. The interesting part about that is we can infer from that 136,000 individuals were not receiving the maximum, and therefore they likely had some amount of income. So I like this data because it shows that truly we are talking about the working poor rather than those that are completely without any income. I always talk about our program as being the profile of the individual in our program really looks like single mom, 2 kids that's working part-time. And in many regards during the pandemic, that single mom has had her hours reduced or the job eliminated completely, and she's had to pick up some kind of gig work. So I think that that's good data to show folks. And the SNAP emergency supplement increase, the total has been about 130 million. Next slide, please. So what we're asking for fiscal 22 and 23 is an additional amount in support of the general assistance program. And I'm sorry, I'm going to need to reference an additional piece of information. But really what it's talking about is right now our budgetary or our allotment amount for GA is about $388 for an individual on a monthly basis. Because of the uptick in the recipient count, we've seen right now that and we're obliged to keep it within the block. What we're seeing right now is if we make a change to be able to stay within our block grant, we know that we're going to have to move. If we make that change in February, the amount is going to be about 250. It's going to go down from 388 to 250 a month. If we wait all the way until April, then we're going to see it at about $155 a month per individual. So, and that's a significant amount when you consider that these are the poorest of the poor in our state. So we truly are asking for 5.4 million for fiscal 22 and 5.4 for fiscal 23 to correct our position as it relates to supporting these individuals. We also, as Director Betts mentioned, talking about the restoration of salaries that were defunded from Act 9, that represents about 40 full-time employees and about 1.2 million in A funds. And again, we are a matched funding in support of our staff. So our A funds, our ability to leverage A funds makes a huge difference in terms of what N funds we can receive from the federal government. And again, as Judy was mentioning, if we're not able to restore the funding, then certainly in addition to that, we're looking to retain the positions so that we don't have to rebuild our organization once the economy is restored or once we have more funds arriving from the federal government. Next slide. So program reductions as it relates to HMS 903. So as Director Betts was mentioning, our ability to meet the needs of the budget in many regards came from our ability to leverage TANF funding. And again, as the director said, it's a fairly provocative move. And that the loss of maintenance of effort puts us in a position where we're just on the borderline of not making our maintenance of effort. And therefore, it opens the door to a lot of inquiry in terms of our operation. The other mention on this slide is the reduction of the preschool open doors program. And it's just by the grace of God and the change of the policies that we're able to shift the 4-year-old children to the federal support and the child care connection. The thing I wanted to make sure that folks know, though, is that preschool open doors in many regards has is charged with providing school readiness rather than just safe childcare. So there is a qualitative difference between providing childcare or providing preschool open door support for children that are trying to ramp up into school age. Please, next slide. So as it relates specifically to, and this chart is somewhat, is filled with a lot of information, and let me try and break it down a little bit. So the item up at the top that talks about CARES Act for 2020, and then the item that talks about Act 9, Bill 126 in 2020. So if you'll notice, it's 11.9 million, and that is due to expire in September of 2021. So we haven't run out the time clock on that yet. The other one that I mentioned talks about the child care facility subsidy coronavirus relief funds, and that's for 15 million. That did expire, but it's been extended, and we've spent so far 11 million on that. So those two are relatively connected as it relates to funds that the federal government has provided in support of our child care programs and our child care facility operators to make sure that they're in a position to maintain their roles in child care support. Act 9, in terms of the child care, that again is our authority in child care. And one of the things that we wanted to note, and it's mentioned down at the bottom, is the asterisk under the 11 million in end funds. That's a ceiling. It doesn't represent all of what, it doesn't represent what our total encumbrance is, or it doesn't represent the total federal appropriation, sorry. And then at the very bottom, when we talk about Act 46, the $5 million, that is absolutely IT driven, and that's something that we're exercising right now. And that's in support of additional child care data and the changes made to the HANA program. And directly above, sorry, I'm jumping around, but directly above in terms of Part 3, Section 10, those 12 FTEs, those are a combination of staff within the child care program office, staff within child welfare, and staff in support of our child care licensing through statewide branch. So go ahead, next slide, please. In fact, I think that's, oh, there we go. I think within this slide, the thing that's most important would be to go directly to the bulleted points on the bottom in terms of the percentage of providers and where they're located, as I might imagine the representatives would be interested in the percentage of providers that are that were awarded grants. And I think it's noteworthy that the 3.3 million in CRF funds returned to UI, we were able to, that's out of 15 million. So we were able to leverage, a ton of money out to the providers across the state. So yeah, I think that's the last slide that's up on the deck. Thank you.
Thank you. Test, can you hear me?
We can hear you, Mark.
Thank you very much. Thank you, Chair Luke and committee members. I'm Mark Choi, the Enterprise Officer for DHS. Just a little bit so that you understand what I am responsible for, right? I'm responsible for IT, the Project Management Office, and infra security. Those those sections roll up under me. Thank you. Next slide. So if we were to just recap what Brian and Judy had mentioned, our BESDI and MedQuest divisions, we've seen since March 2020, because of the pandemic, Hawaii went on lockdown, the economy was hit hard, but our application rolls have increased significantly. While not as much as unemployment, it has increased. But we are kind of a lagging support department, right? But we've seen increases of up to 20%, or, in the BESDI case for our food and financial programs, applications up 50%, right? Equaling maybe 30 to 40,000 additional citizens, right? Caseloads went up, 20%. In terms of on our MedQuest side, 70,000 new applicants, right, were enrolled in their programs. And you've also seen that they've been able to pretty much closely get to 90%, if not more, right, through technology applications as opposed to paper or in person. Same thing experienced, both programs. And these are two of our larger, program business units. And we're still, seeing increases in applications, as Judy had said, and she's expecting to break the 400,000 client mark, this month. And we know that we have to prepare for, the additional surge that's going to come when these extended unemployment benefits run out, right, in March, right? And that's what we have to continue doing. But, leveraging technology and investing in technology, it's not to replace people or anything, but it actually enables us to accelerate how we do our business, how we serve our clients, right? You've seen as part of what they've just talked about, how clearly our technology and the choices that we make and the investments that we make and how quickly we can pivot, it allows us to be agile, right? It allows us to mobilize our workforce, right? Based on what we need to do to serve our client population and our employees who have to serve that client population. Right? We were able to quickly transform how we do our business, where we do our business, and when we do our business, right? So, and we were also able to kind of spin out new services, online services. Brian mentioned that, in a matter of 3 weeks or about a month, we were able to spin out a new online application for BESDI benefits, right? Food and financial. And all of that allows us to execute, right? And that's what keeps us ahead of the curve, or, really allows us to provide the supports that our clients need, right? So next slide, please. So as one example, we took advantage of, CRF fundings and we got about 6.6 million. And we turned that around and we invested in kind of 3 general categories, right? 60% or 59% into our client services and public benefits. So things that actually touch our clients, right? Where they would interact with us, whether that be call center, whether that be online applications. But these are the things that actually mean the most to the citizens that we serve. 27%, we actually focused our investments on being able to maximize telework and social distancing and, allowing for safe practices within, the DHS facilities. And then 14% was, of course, to bolster our infrastructure, our security, and our anti-fraud measures, right? Because as we go and make these programs more available online, or we distribute our workforce, from state facilities to a remote workforce, we have to make sure that we're ensuring and staying compliant with all of our regulatory needs. Next slide, please. So, as far as us and DHS being able to continue to push these results forward, right? We need to continue to actually use technology as a part of our strategy, right? And it's not, like I said, to augment, or it's not to replace people, but we need to augment the people, right? We need to let technology and automation be able to help our employees help the citizens, get to their benefits or get to those decisions on whether they're eligible or not, and get those dollars out, in order to support them. We need to leverage technology so that we can also attract and retain our employees, because as workloads increase and as budget, deficits actually force us to figure out how we need to do more with less. That's our main goal, is to just basically serve our clients the best way that we can. And so those technology investments will help to keep that moving forward. We have existing IT modernization projects that were started a few years ago, or years ago. Kaleo was the first. And so you've seen some of the results in terms of that early investment that we did. And then when the pandemic hit, we were able to quickly turn, right? MedQuest was able to quickly turn and move to remote telework, as well as, provide that basically 90%, online application capability. We're currently in our BES, or our BESD, eligibility system modernization project, and we're just about ready to stand up our child welfare project, right? Through CARES Act, we've also introduced new technologies for the department that will help better our client support or our customer service, right? And so that's new call center, that's additional security, that's automation projects, but these were all introduced to the CARES Act that we're going to need to continue to focus our investments in, so that we can continue this transformation of how we actually do our business. I'll talk about IT staffing in a little bit, but let me get back to some of the data and insights, right? So we, as an organization, we're looking at all of the data that we have. We're looking at data from other departments and other available public sources, and we're trying to become more data-driven, right? So that we can make better policy and program decisions. So we need to focus our efforts in also building up that capacity from a technology standpoint and from a people standpoint in order to better look and understand our data and to provide, management decisions. The pandemic is not going to be forever, but it's not going to end anytime soon. So we need to continue to focus on how we make our office safer, not just for our employees, but for the client and the public. So, while we're having to look at limiting people that are in our offices, we're also looking at, physical things that we need to do to change our offices around. And more importantly, we're actually looking to transform the way that we work and how we deliver our services so that we're a little bit more digital, right? That we can be online, that we can be available to our clients, whether it's on a mobile phone, an iPad, a home computer, or even, coming to an office in somewhat of a protected mode. And then again, we're focusing a lot on remote work, right? Telework, right? That's the new, what we've shown, through 2020. That's how we can stay ahead. That's how we can keep up with the demand. So, we'll continue investments in providing more methods to remote work or facilitate remote working. And then I'll come back to this IT staffing piece, right? Technology in and of itself, really, it doesn't get stood up, it doesn't operate, and it doesn't maintain itself, right? You need IT staff. And, from my perspective, in my organization, I've got 16 vacant positions right now that have been defunded or in some state of defunding and unable to hire. But if you're talking about an organization like DHS, and we're, nearly $4 billion, that's the equivalent of, maybe even a Fortune 500 company, right? We can't run IT or our security or our project management office, with 25% of our workforce gone or unable to be filled, right? And then if I look further at my staff or at my available resources, probably close to 75% of the remaining staff that are here over the next 3 years, they've either got enough years of service or age to actually retire. And that's another, attrition that I need to plan for. And so, ultimately at the end of the day, we're gonna need the IT staffing. I'm gonna need the IT staffing. Next slide, please. And so what I want to close on are these 4 things, right? We, DHS, me in particular, need your support to continue to transform how we do our business, to become more digital and to provide our services to the public in a quicker manner, right? Second, we also need your support, and I specifically need your support to continue with our IT modernization projects, because you've seen evidence of how that helps to enable DHS to remain compliant with our federal guidelines and keep the federal dollars streaming into Hawaii while providing the actual benefits that our clients need when they need it, right? 3, right? We have to brace ourselves and prepare ourselves for the next big surge of citizens that will need DHS supports, right? Brian had mentioned it. When they roll off unemployment, they fall into Brian's programs as far as food and financial supports. But when they're unemployed, they also need healthcare coverage. So that's MQD. Right? If they have issues with childcare, that's another BESD program, or if they need vocational rehab services or counseling or social services from our SSD division, all of these programs, we're going to continue to need that support, right? Right now, I think the numbers that unemployment is projecting right now is we've got about 100,000 people that are still currently unemployed, right? And then when March 2021 hits, there's probably going to be that whole big surge of people looking for financial supports if they haven't been able to get employment. And then another up to maybe 100,000 or so more of people who are underemployed, right? They may have a job, but they may not be making enough, or they may not be making the levels that they used to actually support themselves or their family. And then the last point, that I want to close on is, like I said earlier, technology doesn't run itself. So while we need business positions to actually serve our clients, I need my 16 IT positions to support the technology that supports the business that provides the benefits to our citizens. And that's it for me. Next slide would be Homeless Programs Office.
Thank you, Mark. Chair, I just wanted to check in on time.
Yeah, Director, I had no idea this would be as thorough as and detailed as it has been. In addition to homeless services, what additional divisions do you have on your slide?
We have Division of Vocational Rehabilitation and Social Services Division, which is Child Welfare and Adult Protective. They aren't a lot of slides, so I can ask folks to kind of expedite a little bit, but still cover the highlights.
I appreciate it.
Okay,
thank you.
Will do. Thank you.
Good morning, Chair Luke, Vice Chair Cullen, members. My name is Scott Morishige. I am the Governor's Coordinator on Homelessness and Chair of the Hawaii Interagency Council on Homelessness. I wanted to clarify my role in the department. So my role is primarily focused on policy related to homelessness and coordination across state departments with the 4 counties and with our homeless service providers and broader community. And there's another office in the Benefit, Employment and Support Services Division, BESD, the Homeless Programs Office, that's directly responsible for the administration, the funding, and the contracts for homeless services with our homeless service providers. So I just wanted to provide that context before I get started. Next slide, please. And I wanted to start just with a brief overview of our historical data from our homelessness point in time count. So as you can see from the data, it shows trending over time, and we can see what the impact on homelessness was following our last major economic recession in 2009. We saw over the next several years a large increase of over 2,100 people, a nearly 37% increase in homelessness. And that increase did not start to reverse until fairly recently, within the past 5 years, between 2016 and 2020, where that number went down by about 18% statewide. The historical data is helpful because it helps us to anticipate what we can expect following this current economic recession that we're in now related to the pandemic. So we know that we can anticipate a surge in homelessness, but that surge will not be a one-time spike. It will occur gradually over a period of time and probably at much greater levels of magnitude than what we've seen previously. However, although that might sound grim, there are some bright spots. And the bright spot is that we did see a reduction in homelessness over the past 5 years. And by understanding what contributed to that reduction, and that will help to inform how we can mitigate any future increases in homelessness or to reverse any future increases. So move quickly to my next slide. And like I said, there are some bright spots. And one of the bright spots that we did see when the numbers of homeless individuals on a point in time count started to decrease statewide, we also saw an increase in exits to permanent housing for homeless individuals moving out of homeless programs such as shelter, outreach, and so on. So as you can see on that chart, historically, the number of homeless individuals exiting permanent housing had remained fairly level, both in terms of percentage, which is the orange bar, as well as the actual numbers, which is the blue bar. And then between 2017 and 2018, that number increased pretty dramatically. From an average of about 30 to 40% of individuals exiting to permanent housing to over 50%. and numerically from about 4,000 to over 7,000 individuals exiting permanent housing over the course of a year. What's really, I think, helpful to note is even during the pandemic, our rate of exit to permanent housing has remained high and actually increased compared to the prior year. So in 2020, the available data that we have as of October 31st indicates that the rate of placement into permanent housing was 55% compared to 54% the prior year. And in part, those increases are related to actions that the state has taken related to our delivery of homeless services. So what's key to note, you can see from the red line, in February 2017, the Department of Human Services implemented new contracts for homeless services and embedded within those contracts specific performance metrics focused on the rate of placement into permanent housing, decreasing length of stay in homeless programs to achieve greater efficiency, and also a focus on housing retention, so that we're not only focusing on getting people into homes, but making sure that they can retain that housing over time. At that same time, around 2017, the legislature also provided additional funding for homeless services to include a statewide expansion of our Housing First program, as well as a statewide expansion of our Rapid Rehousing program. So we think those things combined with similar increases in federal funding for permanent housing programs around that time contributed to the higher rates of permanent housing placement. So just to provide some context. Next slide, please. So moving into this current legislative session, the department's priority is to sustain homeless services. And in particular, there's about 10.8 million in services within HMS 224 that's listed here on the screen for the first 4 items. And these items are family assessment centers, Housing First program, Rapid Rehousing program, and homeless outreach and civil legal services had historically been funded on a year-to-year basis. But recently, Department of Budget and Finance did add that 10.8 million for those items to program ID HMS 224 in the budget. And a little bit of background is provided here about what specific pieces of legislation over the past few years provided those appropriations. We do know that these items have been year to year previously. So the department has also drafted an administration bill to seek appropriation for those items, as well as for the 5th item, property removal and storage. The property removal and storage item is not in the executive budget beyond fiscal year 21. However, we did receive an appropriation of $7 million last year through Act 9, and that money has been transferred to the Department of Transportation, who administers that funding. And they are going to be utilizing that funding over both this current fiscal year as well as fiscal year 22. And then we plan to request additional funding for that service in the supplemental year in fiscal year 23. Next slide, please. And this just provides a visual representation of what our homelessness system looks like and where the different categories of service kind of fall into play. So as you can see, the system kind of illustrates what the pathway is as far as for assisting homeless individuals to transition from unsheltered homelessness to a place of permanent housing. So it starts on the left-hand side of the screen with targeted outreach and navigations for our outreach providers, building relationships with individuals out in the community, as well as problem solving for those individuals newly falling into homelessness so we can divert them quickly from the homeless system to permanent housing or other mainstream services. You can see at the far right side that our goal as an exit destination for homeless individuals is permanent housing. And there's different categories of permanent housing for people based on their level of need. For those who are higher acuity, we have permanent supportive housing, as well as HLC. That acronym stands for higher level of care, and that essentially is nursing home facilities or care home for those who have really acute medical needs. And then for those with lower levels of need, we have programs to assist them through our Rapid Rehousing program, which is a short to medium term subsidy combined with short to medium term case management, as well as mainstream permanent housing or affordable rental housing. And our vision also allows for, our system also allows for individuals to be placed into permanent housing directly from unsheltered homelessness, or if they need to go through our emergency shelter system, and recognizing that people may need different length of stay depending on their level of need. So this just provides a quick visual overview. Next slide, please. And then in addition to the service component, my office coordinates with many other state departments, including those departments that manage land, such as the Department of Land and Natural Resources and Department of Transportation, to respond to the practical impact of homeless individuals camping on state lands. So we work with those agencies to make sure that we're able to respond to the complaints. The Stored Property Program in particular is helpful to respond to these concerns. In 2020 alone, that program removed over 5,990 tons, or 13.8 million pounds of trash and debris from state lands statewide, including on neighbor islands, and stored items for 285 households from those properties. This function, although it is primarily a land management function, is also an opportunity for us to engage with homeless individuals on these properties. And we work with DOT and DLNR to make connection to our homeless outreach providers. And during the pandemic, we've used these opportunities as a way to provide mobile testing for people in encampments, as well as to distribute PPE to individuals who are experiencing unsheltered homelessness. Next slide, please. Really quickly, in addition to the items that are funded in the ongoing budget for Department of Human Services, in 2018, the legislature provided appropriation for Ohana zones, which provided an opportunity to partner with the 4 counties to really address the needs that they were seeing in their individual communities. We're very grateful for to the legislature for this funding. And during the pandemic in particular, it provided flexibility for the counties to be able to respond to the needs that we're seeing. And it was helpful in accelerating the onboarding of new permanent housing options during the beginning of the pandemic. So for example, here are just some examples of that. On Oahu, Kumuvai is an elderly permanent supportive housing project that opened in January 2020. It combines a physical structure provided by the City and County of Honolulu with service dollars provided by the Ohana Zone contract. Halamaluhia is a similar permanent supportive housing facility, also on Oahu, for individuals fleeing domestic violence. The bottom left picture is of Kealaula at Pualoke. That's a low-income housing project on Kauai, which was funded with Ohana Zone funding that paid for a portion of the construction services as well as the ongoing services in the initial phase of the site that opened in November and provided 29 units of housing. And then finally on the bottom right is Huliao, that's the old Maui dorms in Kahului on Maui. Construction is ongoing right now, and that's set to open in March of 2021. And I believe the county recently has selected a property manager and is working on selection of a service provider for that site. And both Huliao and some of the other Ohana Zone housing projects also leverage dwelling unit revolving fund and rental housing revolving fund monies from the Hawaii Housing Finance and Development Corporation. Next slide, please. And then Ohana Zones, in addition to bringing online permanent housing, has also helped us to increase the number of homeless access points or opportunities to engage individuals directly coming from unsheltered homelessness. And some examples are just shown here. On the left-hand side, the Honu and Post program on Oahu, operated by the Honolulu Police Department, currently located at Kehi Lagoon. It provides 24/7 access, very low barrier. This was very helpful during the early days of the pandemic when emergency shelter capacity in our congregate facilities was reduced by an estimated 20%. The Post provided an opportunity for up to an additional 150 spaces for individuals to be diverted to. Other Ohana Zone access point projects are Keoloho Emergency Shelter and Halahanakahi and Kalamaku on Hawaii Island. Keoloho is at the old Hilo Hospital facility by Rainbow Falls, and Halahanakahi and Kalamaku are examples of 2 recent tiny home projects that we're able to work with the county on contract modifications on to allow them to fully leverage their Ohana Zone monies to increase shelter capacity both in East Hawaii and West Hawaii. And finally, the RISE Youth Assessment Center is on the campus of the Hawaii Youth Correctional Facility and provides increased emergency shelter capacity as well as outreach capacity for homeless youth. And that's just a brief overview. I believe my next slide transitions to the next speaker. Thank you.
Good morning, Chair Luke. This is Maureen Bates from the Division of Oka Rehab. And next slide, please. Thank you, Chair Luke and representatives, for giving us the opportunity to share DVR's impact in our community. And I'm not going to read through this slide other than to just point out that there is an additional $8 million that DVR receives federally, which is 100% federal funded, no match, for our disability determination branch to serve over 18,000 individuals a year, in addition to our VR matched funds. And as previously stated, all of our programs have federal and state reporting requirements that are done through IT supports. Next slide, please. These funds that are the Randolph-Shepard Revolving Fund, there's been some discussions about possibility of utilizing these funds to help the state in its recovery. And as the previous slide, if you go back and review it at some point, you'll see the return on investment that DVR brings to the table. But this Randolph-Shepard Revolving Fund doesn't really serve the state in the context of utilizing these funds for other purposes. They're very restrictive, and they're intended to be used for these blind vendors. There's over 241 individuals employed in this program, and the revolving account is supported through a settlement agreement primarily. It's self-sufficient in that it generates its own revenue through the vendor's work. And because of the pandemic, we've seen a huge drop in their income, so that any amount above the 1.3 million ceiling that's already obligated through the vendor's advisory group that supports those decisions is already intended for the Maui and Kona airport renovations, in addition to the healthcare benefits all the way through 2023, 2024. So any loss of income to this group is devastating, associated with their independence, their healthcare, and their opportunity to be engaged in Hawaii's workforce. Additionally, we need to keep the funding in the Randolph-Shepard program, or the Randolph-Shepard program revolving account needs to be sustained, because otherwise we can't receive the federal funding that is associated with the Consolidated Appropriation Act of 2021. And that's an estimated 400,000 additional funds, but it could be significantly more as well. We're just waiting on the FITs to come forth and give us the guidance. Next slide, please. So our request for this fiscal year is really to fund that disability determination branch with 2 more positions that are 100% federally funded. So there's no impact on the state budget per se in that regard. We want to keep our other current expenses being reallocated under our VR matching funds from the state, and use these trade-offs of federal funds for the positions at a minimum. We want to restore the salaries of the 30 defunded positions from Act 9, and using the 21.3% state match offset with the 78.7 federal funding. And then I just want to ensure that you understand that the 3.9 million in state match will sustain DVR's federal award 78.7% and mitigate any penalties or maintenance of effort penalties or loss of federal funds in this, and then mitigate any penalties. So we'll be available to answer any questions. Thank you.
Okay, thank you. Folks can continue, but we are close to 12 noon. But I mean, because we canceled this afternoon's hearing, we have all afternoon to ask all the questions. So
Thank you, Chair Luke.
Go ahead.
I did want to mention that we have attached agencies also on the call. Commission on the Status of Women and Commission on Fatherhood are asking for restoration of their base budget. So I just wanted to highlight that for you, but the CARA is available for questions. We also have Office of Youth Services. So Daisy and Bruce, would you like to go over quick highlights of your budget very quickly? And Chair Luke, is that acceptable to you if we proceed that way and
Yes,
wrap it
go
up?
ahead.
Okay,
Yes.
thank you.
Good morning, everyone. This is Daisy Hartsfield. I wanted to just let everyone know that I'm new to the division as the administrator. I came on board in October of 2020, and it's been a interesting time thus far. As you are aware, the Social Services Division is made up of primarily two branches, the Child Welfare Services branch and the Adult Protective Services community branch. I wanted to highlight some major projects that the division is involved with, but if any of the members have any questions or want to meet offline to get more information and find out more about the proposed bills regarding the subject matter, jurisdiction, the impact of COVID-19, or any other details regarding the division and what services we provide, I'd be more than willing to meet offline to provide that with you. But for now, let me just quickly go over some of the division requests. And I'm going to start with the Spouse and Child Abuse Special Fund. We're going to be submitting a bill to increase the ceiling. And the basis behind that is because in 2009, this fund, which was formerly known as SCASA, the Spouse and Child Abuse Special Account, beginning 2019, it was passed that we could receive 4E funds into this special fund. And because of that, we redid our calculations because the fiscal years for the state and the federal government, they don't coincide. So the federal fiscal year ends on September 30. So in order to maximize the money that we receive from federal reimbursements, we want to increase the ceiling to $5 million. And if we're able to do that, then we can use those reimbursements to continue to fund services that will be required under FIPSA, which is the Family First Preservation Services Act, which we submitted the plan to the federal government in December. We're pending approval, and once approved, the services that are provided will be new services. So we're in the process of procuring contracts for those anticipated services. And again, it's to prevent our youth from entering foster care and being able to remain in their family homes. Similarly situated, like the other divisions, we have at least 84 positions in total that were defunded. All but 12 of those positions are split funded with federal monies. So we are hoping that we can get those positions funded by doing trade-offs. And if not, then we're hoping that we can still keep the positions on the books to restore the positions, because if we are fortunate to be able to pay for those positions, then that would be much easier to do that rather than having to get new positions back into the divisions. And the significance of maintaining these positions is, despite the fact that child welfare services have essential workers and the hiring freeze does not apply to them, we are constantly having capacity issues in the branch. And how that impacts us is if we cannot meet certain federal requirements, that impacts the amount of federal monies that we received as well. So we need to be sure that we can meet certain requirements. And the only way we can do that is if we have capacity and sufficient staff to do so. The other impact it has is to the cost of overtime. Without these positions, then we need to have people work additional hours to meet the needs of the community. And so that's the significance as to why we're asking for the defunded positions to be refunded. There are two specific positions that we wanted to make sure you were aware of. The first one is a permanent position. It's the Family First Prevention Services Act. We anticipate that if this is approved, we're going to fund it with federal as well as state funds. And we need this position because, as I stated, the FIPSA is going to be an act. It's going to be new to the state. We need somebody there in the program management position to make sure that all the contracts are in place, that we are accessing whatever federal reimbursements are available, and again, to maximize the ability to get reimbursed for federal funds. And that's another reason why we want this last position here, the service specialist, to be transferred from HMS 901 to 301, because by doing that transfer, then we can access federal funds to fund that position. And it's in the current organizational chart, we cannot access the federal funds to fund this position, but if we're able to transfer it to HMS 301, then we can access the federal funds to pay for this position. Next slide, please. And as stated, we're trying to maximize whatever federal funding is available. Recently, with the most recent passing of the CARES Act, our division is looking at receiving more monies to assist with the court improvement program, as well as waiving the state matches for the FIPSA plan that I just talked about. And I also wanted to mention for our adult protective services, there was an elder justice bill that was recently passed, and there will be a floor of 50 million that's going to be distributed to all 50 states. So we will be receiving additional assistance for our adult protective services branch as well. So in summary, we need these positions. We need these positions, not just for capacity, but also to make best use of maximizing the ability to receive federal reimbursements as well as other federal funding. So thank you. And if you have questions, I'll be available. I'm gonna pass it on to Bruce.
Good morning, Chair, Luke, and members of the committee. With your permission, I'm going to just jump right into the first slide. Is that okay? Office of Youth Services, we're proposing defund 10 positions from HYCF, but we'd like to maintain those full-time positions for future. Those positions are mainly youth correction officers, guards. Second bullet, reduce 2% from program costs as a trade-off for 2 OIS defunded positions. I'll explain more of that in the next slide. Third bullet, reduce 3% from operational costs as a trade-off for 7 HYCF defunded positions. This one, we already have warm bodies in a few of these positions. And these positions are like the cook, the farm manager, admin assistant. We've already hired people for those positions, and we are in process of hiring the rest of them. We're interviewing, background checks. So we're in process for these 7 already, just to let you know. The fourth bullet, we'd like to reduce our 10% budget reduction. A lot of this, the reason we're asking for this is a huge chunk of this, one large portion is for mental health services. And due to COVID, mental health services for kids in trouble are up there because they're locked up. They are, because of the lockdown, they're home with their parents, no school. And when kids want mental health, we definitely need to respond because most kids don't want mental health. And we need to support families due to COVID, unemployment, anxiety, stress. I think you guys know all about that. And the fifth bullet, reduce our 7% budget reduction for HYCF. That one is, we provide a lot of different services with that money. Part of it is monitoring, incentives, licensing. There's a whole variety of things we do with that fund. So we're asking for that. Next slide, please. This slide is a snapshot of our diversion programs. If you don't know OIS, our main focus is really to divert kids away from the juvenile justice system, diverting them from deeper penetration, because the deeper they penetrate, they're going to end up at Halava or the federal system. And initially, we want to divert them from HYCF. Back in 2014, it was approximately $200,000 per youth, our yearly cost. But economies of scale, if you factor that in today, it might be closer to $300,000 or $400,000 per youth now. So we definitely want to keep them out, and the cost to society is pretty great. Okay, next slide, please. This slide is our temporary impact of reduction in juvenile arrests due to COVID-19. And this is from JJIS, the Juvenile Justice from Family Court, the information system. And we think the reason for this is kids aren't in school. We have definitely high unemployment, so there's more eyes, more supervision in the community as a whole. When they're not in school, they can't be with their friends. They can cause mischief or less chance of that. Stores, shops, etc. are closed as well, retail. So you can't go in and rip off and do all these kinds of mischief. There's a whole number of reasons. If you have any questions, definitely I'm here for that. Also online is Warden Mark Patterson from HYCF and our accountant, Jack Orimoto, if you have questions. Thank you, Chair.
Chair, as I mentioned, we have attached commissions to respond to any questions, but as I mentioned, we're just requesting that their budgets be restored. So we can go ahead and skip over the last presentations. Mahalo for your time. I know that we went over quite significantly, but we really wanted to, really be transparent about all of the services and benefits that we offer, as well as the budget crisis that we're facing. Thank you.
Thank you, Director, for a very thorough presentation. We have questions from Representatives Martin, Wildberger, and then Peruso.
Aloha. I have a question on MedQuest for Dr. Moore Peterson. I understand in general, telehealth has been so successful, and hopefully we'll never go back from using it in the expanded way that it has come to be used. I've had inquiries about telephone health. So some of our, needier recipients of healthcare don't have access to video and smartphones and whatnot. And what is needed in order to maintain the telephone health reimbursement from MedQuest? What needs to be done to keep that going post-pandemic?
Well, a couple of things would be needed. We actually do intend to try to find a way to be able to continue to cover sort of audio-only health visits. We understand that from a clinical perspective, not everything can be done using audio only, but we also understand that it is an equity issue for providing services for our members. There are some federal rules that have been suspended during the pandemic that allow audio only to be used as telehealth. And so we have been taking advantage of that, which is why we've seen that tremendous expansion. We are looking at how we can sort of define it in a way that doesn't go awry of the federal definitions of what's allowed, et cetera, for privacy and for telehealth. And then look for alternative payment methodologies to be able to continue that coverage. We're looking at what Medicare is going to might be able to continue, but for those of you who are not aware, that Medicare has much more restrictive rules around the use of telehealth, so we can only use their models for a limited time period. My team is right now really doing a deep dive on how we might be able to continue with at least, I mean, even if it's not the full payment, but at least some way in which we can continue to maintain audio only.
Thank you for that. If there's some way that I can help from the legislature, let me know.
Happy to do that. Thank you so much. And thanks for the question.
Okay, thank you.
Thank you. We have questions from Representative Wildberger, followed by Peruso, Tam, and Sayama.
Thank you, Chair. For Director Moore Peterson, please. Aloha. Thanks for being here today. I was wondering if you could give us an update on the status of the bid dispute where 10,000 Quest members are going to lose their coverage from Kaiser and end up with maybe a lack of providers to provide the services that they're going to need on Maui that was sort of suspended last year. Thank you.
Right. So we, as I believe we sent out this information, but last May we rescinded those contract awards, which I believe is what you're referring to. Mm-hmm. And so those contract awards were ceased. We stopped that. We went through a request for information. We gathered a lot of information from the community. We heard from over 30 some organizations, community members on responding to the request for information. We recently issued the new request for proposals, and I think within that we have a maximum number of health plans to be 5. We currently have 5 health plans that are serving our members, and while we have a preference for statewide, we understand that not all of the health plans have the capacity to be able to go statewide, and so it's a preference, but it's not a mandatory thing. We're right in the middle of the procurement process right now.
Okay, so it's a non-issue, or it could come up again because we may end up in the same situation?
It would only be an issue if all the health plans did not turn in a proposal.
Gotcha. Okay. And one more question, if you would indulge me. Can you tell me how many state employees are on the Quest program?
I don't have that information. We will need to do that research and get back to you.
Thanks. I'd love to know those numbers. I appreciate your time.
Mm-hmm.
Thank you, Chair.
Representative Wildberger, did you want to ask about Ohana zones?
Oh, Mr. Morishige covered that in his presentation. Thank you very much.
Great, thank you. We have Representatives Peruso, Tam, and Sayama.
I'm also very interested in that follow-up to the last question asked by Representative Wildberger. So I look forward to that response about how many state employees are eligible for SNAP. But my question is for the director for the Commission on the Status of Women, if she is still with us. There's so many names, but I was very struck by the analysis of basically that emerged from the research done by this office on the impact of the pandemic on young women of color. And I wanted to see if you could summarize that for us, because I think that that's really one of the central contributions of your office. I don't see her on the call. Is she still here?
Hi, so I'm here.
Okay, okay.
Thank you for your question. I will try to answer it really quickly. You know, commissions, not just CSW, are often deprecated as non-essential, but we firmly believe that women's equality is a core function of the state. And, you know, this pandemic has impacted everyone. That is, there's no doubt about that. But it has been particularly punishing for women of color. And because we are a women of color majority state, as well as having a large Native Hawaiian population, need to be paying particular attention to how we can identify, prevent, and correct the disparate impacts of COVID-19. So even when it's come to unemployment, we've seen that the majority of those who've experienced job losses are women of color in Hawaii. We've seen massive increases in domestic violence with our anti-violence service providers across sectors, not just DV, but sex trafficking at maximum capacity right now. And I could just keep rattling off different impacts. There was a recent report covered by Civil Beat on single mothers, et cetera. So there are groups in Hawaii who are unable to cope with the pandemic in the same way that other groups are because of historic and continuing disparities. So I believe that, yeah, we are asking for the restoration of those cuts, which amount to 20% of our operating budget. It's only $11,000, which might not seem very significant in terms of savings, but to us, we will feel that very hard, and it will probably impact most our ability to represent the neighbor islands well. So thank you for your question. That was sufficient.
Yeah, thank you.
Thank you. We have questions from Representatives Tam Sayama and Wildberger. Unfortunately, I have to actually make a presentation at noon, so I will be signing off. I will be turning this hearing over to Vice Chair. So if you have a question, you can continue to raise your virtual hand or direct message Vice Chair. Thank you, Director. Unfortunately, I have to get to my next presentation.
Thank you for your time and patience today, Chair Luke. Appreciate
but
it.
members, please continue your line of questioning. You know, this will help us as we make decisions on various budget cuts. Thank you.
Thank you so much. My question is for Director Onsafi from HPHA. You still there?
Hello.
Hello, Director. So my question is that I heard news that you're trying to lease up to 700 Section 8 families, and I wanted to know if you reached that goal.
Yeah, hello, Representative. Thank you for the question. Yes, in late last year, there was a grant that was available for us to apply. We did apply to HUD and received $2 million. Because it came towards the end of the year and we only had a short amount of time to spend it, also gave us an opportunity to serve more. So we challenged the staff. We usually lease up about 30 vouchers a month, and we tasked the staff to do 25 times that amount to 750. We are pleased to report that we have reached our goal. We issued a little over 700, as of today, a little over 750 vouchers, which will bring a tremendous amount of value to the state for years to come, because HUD gives us the funding based on the total amount leased. So we went, just in the Section 8 program that this grant was, we went from 1,445 vouchers, we added 750. That's 52% increase. It only happened this year. So yes, with that, the entire agency came behind this, Section 8 staff and others. We did drive-throughs for files to keep everyone safe and healthy. And we're grateful that we were able to issue that many in an extremely short period of time. I hope that answers the question, Representative.
It does. Thank you so much. And another question that I had was, did I hear you correctly in your presentation that there's only one general funded position at HPHA?
Yeah, that is correct, Representative. A little over 300 positions, of which only one A-funded, general funded position, and that position takes care of the rent supplement program.
Okay, thank you so much.
Thank you.
All right. Thank you, Representative Tan. Adrian, Representative Sayama for question.
Thank you. My question is regarding the Division of Vocational Rehabilitation. Throughout our finance hearings, we've been approached with DBED and DLIR. Each have their own respective workforce development programs. And I was hoping that you guys could clarify what unique programming DVR provides that separates its functions from these other workforce development programs.
Thank you, Representative Jackson. Sayama, my name is Maureen Bates, and DVR is very different from the Department of Labor and also Department of Education and Department of Health's Employment Support Services. In particular, DVR is focused on individuals who are eligible with significant disabilities that impact their ability to get fair pay and equal opportunity in the workforce. So we pay for people to go back to school. We pay for them to gain skills that other Department of Labor would not be able to pay for, and we pay that support to help them gain those skill sets, whether they're soft skills, whether they're credentials at colleges, PhDs. We want our participants to have equitable pay for equitable work, and right now it's a 39% disparity in those hours and wages if you're disabled and non-disabled in the same job. So we exist for that purpose. We provide much more intensive supports associated with advancement and skill sets to get into the workforce, attain jobs, retain them, and advance. And I do believe Department of Labor has no such funding associated with the level of support, including reasonable accommodations, job coaching to also help incentivize employers. We have a lot more on-the-job training supports. We can pay those employers costs for that employee at that work site so they would be more invested in engaging or hiring that individual after that internship. Does that help answer what you were looking to?
Yes, thank you for the clarification. My second question is related to the Ohana zone, so I guess it would be directed to Mr. Morishige. Does the governor, I guess, intend to continue with programs like HONU and POST that have been started during the pandemic throughout fiscal years 2022 and 2023?
Thank you, Representative Sayama, for the question. The Ohana Zone appropriation is a one-time appropriation, and when we entered into contracts with the counties, was with the understanding that the counties would look at a way to sustain those programs beyond the end term of the contract. Currently, the HONU/POST contract is with the city and county through May 2022. And we've already begun discussions with the city and county about looking at ways that they can sustain the program beyond that.
Thank you. No further questions.
Thank you, Representative Sayama. Representative Wildberger.
Thank you, Vice Chair. For the Housing Director, please. Hakeem.
Aloha.
Thank you so much. Nice to see you. I have the same question for you. Can you tell me how many state employees qualify for rental assistance, please?
For the COVID-19 rental assistance program, that was run by HHCDC and two major nonprofit organizations, so we do not have that data. With regards to our public housing, all of our tenant aides, 19 of them, that will be 19 families that are in our public housing. There are other employees through exemption. We estimate are about a dozen. So on and all, we have about 24 employees that qualify for the public housing component. There's also possibility that through the Section 8 program, some may have been with their families. For example, if somebody is under their father or mother, that they will qualify based on the income.
I gotcha. Okay, thank you for that information. I appreciate it.
I thank you.
Members, any other questions? Representative Peruso.
Yeah, hi. So I have a question about the sustainability funds for nursing homes and hospitals. I'm not sure who can best answer that question. My question is whether or not those increases in fees have to be agreed to by the hospitals and nursing homes.
Thank you. Members, any other questions, or did they answer your question, Amy?
No,
Sorry,
no one has.
Waiting on Dr. Moore Peterson to come on screen. I'm not sure what happened. If she's not able to get on screen, we can take that question and respond in writing if that's acceptable to you. Okay, thank you.
Also talked about
Amy, did you get your answer?
They're gonna follow up. And
Okay.
Sorry, my computer froze. I am so sorry. My computer froze and my mouse wasn't moving. I couldn't get it off of mute, etc. I was like, wait, no, I have the answer. So, sorry about that. We did need to agree to that. We have had a very long, robust, and collaborative conversations with HAH and the hospitals, and we do have agreement on the, and it's on the hospital side is where we are looking to increase it in order to leverage additional federal funds on behalf of the MedQuest program. And yes, you've had very long, extensive, but collaborative conversations, and we do have agreement.
Great, thank you so much.
Yeah, sorry about that, yes.
Thank you, members. Any further questions? Members, any other questions? Okay. Director, well, thank you, Department of Human Services, on a very lengthy committee hearing. Thank you, members, for the stamina you guys provided during this important information that was provided, and we will commence our informational briefing today, and have a great rest of the afternoon. Thank you, Director Betts. Meeting adjourned.